I am Dr. Raza Bokhari, and I serve as the Executive Chair and Chief Executive Officer for Medicus Pharma Limited. We are a NASDAQ-listed biotech life sciences company advancing novel and potentially disruptive therapeutic assets uh, through proof of concept studies. We're very appreciative of Dermatology Times, especially when we came on the scene in the fall of 2023 and had submitted our first study design with the FDA for our phase 2 proof of concept study for SkinJect, our lead asset that comes out of Carnegie Mellon and University of Pittsburgh, which is a uniquely designed microneedle arrays. These are dissolvable microneedle arrays that are tip-loaded with doxorubicin in microdoses and applied directly at the site of the lesion of non-melanoma skin diseases, particularly basal cell carcinoma of the skin. They trigger an immunogenic response and cause cell apoptosis. Since January of 2024, we have come a long way. We today have completed that study design that we had submitted and have completed a 90-patient study in 9 sites across the United States, where we had randomized 90 patients in 9 centers in a triple arm study, a low dose arm of 100 microgram and a 200 microgram arm, which compared to a device only control, and also had variables of examination and excisional biopsy for half of those patients at day 29 and for the other half at day 57. And the final top line results that we released in the early part of this year, followed by an expanded analysis. We are very thrilled that we have a clean dose response, and our 200 microgram cohort at day 57 have shown the best efficacy, both at the clinical clearance or visual clearance of 64% and our histological clearance or complete response in 55% of those patients that were in the 200 microgram cohort examined at day 57. So that finding, which is a proof of concept finding, a decision grade finding, we believe are also registrational grade, and our entire end of phase 2 study package that we plan to submit to the FDA for a pivotal study approval is around the 200 microgram dose. And we have high confidence that a registrational study will be signed off, and sooner rather than later, our skin patch will become commercially available for non-melanoma skin diseases, especially basal cell carcinoma and the nodular type of basal cell carcinoma. And the background of this is important to set the stage to talk about what your question is, which is the Gorlin Syndrome application of our patch. In the fall of last year, a patient advocacy group called Gorlin Syndrome Alliance that represents a registry of 11,000 Americans that are inflicted with this rare autosomal dominant disease called Gorlin Syndrome. Gorlin Syndrome is also called a nevoid basal cell carcinoma lesions. Being an autosomal rare disease, they have several comorbidities. It's unfortunate that they also are never cancer free. One of the most uh, aggravating manifestation of Gorlin syndrome is multiple basal cell lesions throughout the course of their life. These basal cell lesions can be more than 500 to as much as 1,000 lesions throughout the course of their life. These patients with Gorlin syndrome, which is one patient in, I believe, 31,000 births, is diagnosed with that. And in early childhood, they begin to manifest these basal cell lesions and go through multiple surgical interventions, which is not only expensive, also disfiguring. They have lots of psychological challenges. And to add insult to injury, Gorlin syndrome patients have no approved FDA therapy as a first line of treatment. They approached us in the fall of last year to see if we would do a study of use of our patch for Gorlin syndrome patients, since we had in our interim analysis that we had completed in the Q1 of last year, the interim analysis showed a clinical clearance, which is visual clearance of more than 60%. And Gorlin syndrome patients had this aspiration that even if they don't have a histological clearance, which is a complete cure of their cancer, but at least cosmetically they could get some visual relief, and if this patch could be used. So we picked up on that ask, formed a collaboration with them, and after we had completed our top line release, it was appropriate for us to do a cross-functional IND, a registrational IND that we have submitted, where we are asking the FDA to give us a sign-off where we could, in an open label study, do 50 Gorlin syndrome patients and apply the patch and only examine them for visual relief. And if the outcome is similar to what our phase 2 study has shown, 2 out of 3 patients will get those lesions released. So a very long answer to your question, but that is what has propelled us to pursue a treatment for the ones that need it the most and also have no current approved therapy available.